Good evening and a warm welcome to all of you to IHW Council's special web series on women's health, Break the Silence, Feminine Health Matters. I'm Anisha Nair Dhawan, your host for the evening. In association with Alma FemiLift, today we will talk about regaining feminine beauty and confidence. Now, vagina beauty is the new wellness trend that is emerging these days. Now, the wellness world is fulfilling all aspects of beauty and is now pushing intimate care well beyond the pharmacy shelf. For women, the way they look and feel becomes an important part of their self, from adolescence to menopause and beyond. So, just like you take the time to take care of your health by sticking to an exercise regime or getting facials to keep your youthful glow, there are solutions available which will help you feel young and supple during the intimate times you spend with your partner. Did you know that vaginal rejuvenation, which is a non surgical treatment, could be the answer to your loss of confidence and comfort? What does it involve and how does it make you feel afterwards? These are some of the issues that we will be discussing today. We have a panel of knowledgeable experts joining us, so please welcome Dr. Narendra Malhotra, obstetrician and gynecologist, managing director, Global Rainbow Healthcare, Agra, and he's the director, Landonald School of Ultrasound, India, president, INSARG, the Indian Society of Aesthetics Regenerative Gynecology. Please also welcome Dr. Preeti Jindal, senior consultant gynecologist, IVF high-risk pregnancy and cosmetic gynecologist, specialist doctor at the Touch Clinic, Mohali, the General Secretary of INSARC. Please also welcome Mr. Madhusudan HK, President of ALMA India. A warm welcome to all of you.
Thank you. Thank you so much.
Right. Now, for the audience who is watching us today, if you have any questions that come to your mind regarding the topic today and what we are going to discuss, do put in your questions in the comment box of this live post. Our experts here would be happy to answer all the questions that come to your mind. And do like our page and share it with your friends if you feel that it can help the other friends and family that you have. So let's begin with the session and take up the first question. And this question is addressed to you, Dr. Malhotra. Why is it essential for women to regain their feminine beauty?
See, women, why not? Is the first answer. Why not? So women are, they always, from birth to menopause, they undergo so many changes in life. And with the hormones coming, these changes affect the body very, very strongly. It's a childhood, which is like everybody childhood. You're playing, suddenly at 9 or 10, you start menstruating, and there's a sudden change, and the bubbly, jumpy girl, tomboyish, suddenly withdraws, and then the breasts develop and the hairs develop, and suddenly she's again shaken up by the changes which are happening to her and not to the boys around her in school. Then, of course, she at teenage, it's the psychological and the mental and reading books, watching movies, all those thoughts of sexuality and all arise in her body and gives another different change. And then she gets married, delivers babies, and then she is at perimenopause when the estrogen hormone falls and everything body sags and becomes loose. So at all stages, this wonder human being, which I call women, which are the strong one, has to adapt to so many changes and has to look good and has to make everyone feel happy and has to make everyone feel good. So whether it's the parents, whether it's a teacher, whether it's the boyfriend, whether it's the husband, and whether it's the children later on, she has to have self-confidence. And if she undergoes so many changes, that self-confidence sometimes tend to lose. So yes, feminine beauty is very, very important for this girl, lady, and to boost her own self. Not that she's looking good or sexy or things like for the others, it's for her own good that she feels good and confident in life. So that's my take on this.
Dr. Preeti, what's your take on this? Why do you think it's essential for women to regain their feminine beauty?
As very nicely put by Narendra sir, that a woman undergoes a lot of changes, and it is an inherent feeling in every woman to look good and beautiful and feel joyous about her own self. So we need it, to put it plainly into few words, again, why not she should look the way she is, and why any changes in life like pregnancy, childbearing, delivery, menopause, recurrent vaginal infections, or because of the trauma of vaginal trauma because of the recurrent sexual activity, should tone her down and should have leave a lasting impact on her body. And another important thing is that not only it is for the self confidence, even for the functionality, because all these changes not only they make your beauty go down a bit, but also it also affects the normal functioning of a female body. Like the women, they start losing urine on coughing, then the breast they sag, the pelvic area it becomes more vulnerable to infections, the vaginal area becomes more vulnerable to painful intercourse, all these things. So to regain that also, so it's not only about the beauty, it's also about overall rejuvenation of the body.
Yes, perfect. Functionality
Right.
also improves.
But Dr. Malhotra, for many years, women are led to believe that this is the process of aging. This just happens to you and deal with it. It's different now, isn't it? You don't have to deal with it. There are things you can do to not go into that. Life is done. I got to deal with it.
So still a lot of that olden thought still persists. And I'm sorry to say, in the general practitioners and the doctors also, a lot of thought. When a woman comes to say that I have lost interest in sex, I've lost interest, I'm feeling loose all over, I'm dribbling urine, or I feel very heavy in my perineum. अरे ये तो old age का काम, ये तो होएगा. Just get yourself adjusted. Don't worry. एक दो drop leak हो गया urine तो क्या हुआ? थोड़ा सा dry intercourse है तो थोड़ा jelly लगा लो, cream. So that sort of attitude now, with the advancement, with the education, with the awareness, with the things we have now, is definitely going to change the whole look towards these problems. And what I call them as her unspoken problems, which she was never speaking about. Now, we doctors who are understanding these problems now get a lot of women who come and talk to us about these. Now, if they don't talk also, sometimes you have to bring them up to talk. So sometimes the doctors have to ask the leading question. Do you have a urine leak out
Right.
on last? Do you feel loose? Have you lost interest in intercourse? Is your intercourse painful? So sometimes positive, we have also to ask. So these are her unspoken problems, which women are coming out more and more now because of awareness and because we have things, drugs, non-surgical methods, everything we have to offer something.
Right. Mr. Madhusudan, Dr. Malhotra is saying that there is awareness. Some women are willing to talk. But I think a larger majority of women would still be, thinking of this as in, in the way it happens to women for eons together. So it's nice that Dr. Malhotra has some patience, and it's nice that he's so patient to even take out the time and talk to women and help them open up to these issues which they may not do. Now, what initiatives is Alma taking to create awareness about regaining feminine beauty and confidence, so that women don't feel that this is just too much out of the ordinary, and this is something that should be, if I can go to the parlor to get a facial, or if I can do something to improve my health, why can't I do this? So what are you doing to create this awareness?
True. I think, first and foremost, this is about education. So we believe the education has to happen at two levels. One, I think, first of all, it's about the condition itself, which means it could be SUI, and it could be atrophy, it could be many other indications, which we're going to talk about. It could be the indication itself. The second, awareness is about, if someone actually is going through this, it's difficult situations, there is something that is available. So what we have been doing, is that actually both of these things, one, the condition per se, Second thing, the treatment, that is available. Like, Dr. Narendra Malad was talking about, there are very simple methods, that are there, that can be employed, to treat in all these difficult conditions. You don't need to go through these difficult situations in silence. So we what's important, is to encourage one, of course, the consumers to talk, more about it. And of course, we also understand that there is certain section of, the medical fraternity also need to now, talk about this. So what, we have done, for us, and it's a journey. So it's about which, we have started about, 3 to 4 years, before. And this during this journey, what, we have been, doing is, I think the most important thing is, we have partnered, with the leading, practitioners, across the, India, to conduct education, programs. The second and important thing, is that, we have entered, into tie-up with major hospitals to conduct the programs. So therefore, we are able to talk, we're able to, reach out to people. And these conditions, and I think, what is the most essential thing, is to talk. So therefore, unless until it is spoken, I think, and then given the culture, we are, and then we have been brought up, and then we are in, I think, these things are a little difficult to initiate. So therefore, I think that's, one and most important thing. And now, with this, break the silence in a campaign, and this is a major event, for us, and through which I'm very happy to give you some stats, in terms of, what, we have done. We have been able to take help, of the leading, experts. Some of them are, there, today, in our program. And then we have been able to reach out. I can tell you that, we have reached out to lakhs of, people who have seen this, program. Thousands, of them actually have interacted, through this, program. So they have said, okay, good, bad, and then they have given some suggestions, as well. We have thousands of them have actually seen this, videos. So we have done 5 web talks, series, through which, we've been able to address various, feminine, issues, challenges, that the women, is going through. So for us, actually, it's a journey, and it's begun, and we have seen, both there is an engagement, there is a discussion that has begun at the clinic level, but I think there is a long way to go, but we are up for it.
All right. Dr. Preeti, in your practice, have you seen that, when vaginal health is not optimal, especially after childbirth and, during menopause and menopausal conditions, does this in fact impact the way women feel about themselves, and does it impact their confidence? Does regaining this beauty help boost their confidence in women? Do they do better in all aspects of life?
So, since time immemorial, vaginal health has always been in picture, irrespective it is 21st century or it was first century. As we would recall, the first plastic surgeon of the world is Sushruta. He is an Indian, and he wrote Charak Samhita. In that, he had mentioned about the vaginal surgeries and vaginal rejuvenation. Even at present, in lots of traditions, and even in Indonesia, there are few traditions which are done to rejuvenate the vagina after childbirth. And that is with the help of smoke or some chemicals which increase the warmth of the vaginal area. The basic purpose of it is to enhance the rejuvenation by enhancing the functioning of elastin and collagen cell. So in the OPD, not only me, I'm very sure every obstetrician, when they come across the women in their postpartum period, if they ask the women that what are the main problems they are facing, the first thing they would obviously not say about this, but on further probing, around 80% of women say that they are not able to resume their sexual activity because after the childbirth, because of vaginal dryness or hypoestrogenism, or they just do not feel like doing it. Now, not feeling like having a intercourse could be because of either hormonal hypoestrogenism, which is there with the breastfeeding, or if you probe further, it could be because of the fear of pain and dryness. So it is a very common problem, and it is very understandable because the hormones go so much up and down. Secondly, those who had vaginal delivery, the episiotomy sites, the cut which we give at the time of delivery, that site may lead to scar formation. thirdly, because of the breastfeeding, the estrogen levels, they fall down, prolactin levels increase, and they lead to the dryness of the vagina. Fourth, the vagina, because of the prolonged period of bleeding after delivery and discharges, is more prone for the infections, and women are not able to take care of themselves that much as they would do when they did not have another baby dependent on them or another life dependent on them. So they are more prone for infection. So all these things, they do affect their normal married life. It also affects their confidence. And as put for by Mr. Madhusudan and Dr. Malhotra, that people, women have that taboo, that thing that this will happen. Now the things are changing. Women are very outspoken, I feel, because I work in a cosmopolitan area. I'm in Chandigarh, and so here the women are very empowered, and they come forward and they say, doctor, we do not feel like having it, we need something to be sorted out. So awakening is happening thanks to Alma's initiative and all web talks which you people are doing. They're really helping the people. They're coming and they're asking for the help.
Right. Dr. Malhotra, would you like to add there? What have you seen in your practice? Do women feel more confident once they have taken any, steps or measures to rectify the situation?
So I am in place Agra, which is a mid-town. But even since we have put forward that we are now a cosmetic gynecological clinic, and we have special privacy and a special person who will be a senior doctor like me, talking to them in privacy about anything which they want to discuss. Still, the common problems we still get is not about intercourse or not about sexual weakness or not about looseness. We still get a lot of questions about vaginal discharge, vaginal itching, repeated vaginitis infections, repeated urinary tract infections, and uterine body prolapse, a little bit of it coming down, and urinary incontinence of frequency. So when you probe these further, with these problems, when they're having these problems, for whatever reason, when the child delivers, a 3 kg child comes out of that area, it makes everything loose and tears up, and makes coming a little later. And she has repeated normal vaginal deliveries in 3-4 years. Some of them have 3 or 4. Then the whole thing is very, very loose, and then that is the problem which arises because the husband is not satisfied. Then he takes it out on the wife. She loses her self-confidence. The whole family and the household life gets disturbed. So yes, when you probe them, when they come with the other problems, the medical related problems, they will usually tell you, most of them, to the tune of 60-70, yes, they also have the sexual and the feminine problem also, which they were not able to talk. And if they've come with their husbands, then we call them in and talk to both of them together. What exactly is your problem? And if it is simple infection, it's treated like that. If it is dryness, it is first treated with local medicines, and then you have a host of other things which can do that. And if it is a painful scar which is there, the episiotomy and all, again you can non-surgically heal that scar or cause better healing and less pain over it. So we have a lot of things now to help these women.
Right. Dr. Petey, Dr. Malhotra has told us about, step 1, step 2, step 3, which can be taken to, resolve these issues that impact family life. It's just not the health, the well-being and the confidence of women, but the entire family's, happiness and state of mind gets affected. So could you tell us, Dr. Petey, what are the new techniques through which regaining feminine beauty can be achieved?
Right. So we are very lucky to be living in an era where we are now have the luxury of using non-invasive modalities and lots of new technologies to help these problems which were always thought to be as a part of life or untreatable. So depending on the cost, I'll just name the modalities. The laser is a very good modality. It was in fact one of the first few things which were introduced for the cosmetic health or the rejuvenation health of the women. And in fact, I also started first with the laser modality only in the cosmetic region. And I'm very happy to say that because of the support of the Alma, and we all have, Dr. NM sir, and we all have Alma's Femi Lift, And we have created a big awareness in at least in our regions, by holding this in society, in SARC society, and then by regular web talks. And we did one very big conference on cosmetic gynae last year, and we plan one next year. So in this, basically the one very good and easily helpful modality is the laser. Apart from that, radio frequency, platelet rich plasma, high fem technology, carboxytherapy, and local creams which are available. Estrogen now is available in very good forms. Not only you have to take it orally, because oral medicines have more side effects, you can apply it locally on your skin. Estrogen pumps are available. And these are few things which are very helpful in building up and rejuvenating the area. I believe we are going to stress on these therapies later on. Yeah.
Right. Dr. Malhotra, would you like to add here? Because Dr. Petey spoke about estrogen, but the hormone replacement therapy as a treatment for this is not recommended, especially with people who may have a history of breast cancer in the family. Dr. Petey has told us about a lot of these things, but in simple language, I understand the laser, because laser is something everybody is familiar with. You get laser for removal of body hair, laser for wrinkles on the face. Yes. So could you tell us, these treatment options? What are they? Are there any more which are simple and safe that women can use?
So first thing what we did was that instead of making a society for cosmetic gynecology, which a lot of people objected, why do you need cosmesis in gynecology down there? It's enough on the face. So we called our society as Indian Society of Aesthetic and Regenerative Gynecology. So aesthetic covers the cosmetic part, and the regenerative covers the functional part, because they both are together and they both happen together. Now, when you can use laser facial and want to make your skin tight and make fairness improve, you can do a laser on the surface laser on the breast to lift up the breast, the abdominal wall folds which are sagging, the scars which you have on the pregnancy, birthmarks. So it's just not down there. It's a complete body thing. Laser is what? It's light amplification of which goes through a crystal and then it splits. And this special laser which we have splits into 80 beams. And when the 80 beams hit the surface, which could be a square or an area which you mark here, supposing I want to do laser on my skin here, something is sagging, a scar mark is here, I want to remove this. So I put that here. So those 80 things will penetrate into my skin to a depth of about 6 millimeters, not deep, enough to injure my skin or cause bleeding. And that causes heating inside, and that causes the body to self-repair that area. So it's actually the body which is doing the work themselves. The collagen under the skin gets tightened and more new blood vessels flow in. So more the protective factors which are in your blood, the natural killer cells and all, they all come there and they improve the skin. And it's like fighting. You get an injury, you get a bruise, it heals by itself. So it causes bruising under the skin. And that is what laser does. You somehow below the area.
So this laser can be done for, tightening the vagina and, improving the collagen there as well.
So we can do it for, on the surface for changing the color of the skin. Some people want to look fairer, not only on the face, but on the body skin also. So, and even on the external genitalia also. So we can do a lightening laser. And then you have a probe, a laser probe, which rotates on the tip with a tip that you can put in the vagina, and it automatically rotates and goes in and out. So at 360 degrees of the vagina, it heats, it causes the small beams to go into the whole vagina, and that causes healing. See, there'll be no bleeding, no injury, nothing. It's safest possible procedure ever and it has been passed to use inside the abdomen. When we do laparoscopic surgery, when we cut endometriosis, we use laser. So why on the skin and vagina, it's absolutely safe and simple. And it's what we call as a coffee break procedure. The women go to office, 11 o'clock, they take an appointment to the doctor, they get a half an hour break, 15 minutes 20 minutes of laser, they come back and start working. Nothing to be done at all. So that's, and then they repeat the procedure after 1 month and another month, and then a memory procedure every year. So that's simple.
Right. Dr. Petey, this is a coffee break procedure. Is it painful? Because, in a laparoscopic surgery, you're like knocked out. You won't feel a thing. But what will you feel here?
This is the beauty of these procedures. These are non-invasive procedures, totally painless, and it just takes 10 minutes. So what actually is done in this procedure is that the patient comes. It can be done in the outpatient setting. It does not require OT setting. And it's a special machine. The FemiLift machine has got a robotic arm, which we all have. And it is a very, very user-friendly arm as well as patient-friendly. The patient just lies down on the couch, and then there is no need of even the local anesthetic cream, because the vagina, the upper 2/3 of vagina is totally pain-free. The lower 1/3 of vagina has nerve fibers, but then the settings which you do, with that you do not need any anesthetic. And as Dr. Narendra sir just told, that there's a probe which goes inside the vagina. So if this is the vagina, the probe goes inside, rotates 360 degree. It warms the area in different segments, 1 centimeter apart. So just 3 passes are given. Once it goes inside, then it comes outside, and then goes inside. Sometimes if the patient is having too much of a problem, we can give 5 passes, and that's it. And then she just walks away. She can go for her work or whatever. There is no soiling of clothes. There is no bleeding, no pain, nothing. So that's the actual beauty of these procedures. Yes.
Sounds quite simple and quite effective. Mr. Madhusudan, how is Alma FemiLift working towards the cause of regaining feminine beauty and confidence?
Okay. For us, the feminine beauty, is part of the larger cause, which is feminine health and wellness. And therefore, I think for us, what we believe is if your health is good, then I think your confidence automatically builds up. So therefore, I think very important point is that how good you are. It's not necessary that you look good from outside or inside. What's important is that how is your health today. So therefore, I think we always start the conversation with how are you. So I think the confidence comes from the fact that actually you are good with your health. So you can therefore take or carry your normal day-to-day activities, be it participating in social activities, or be with your husband or anything of those kinds. So what we have realized is that these conditions, let's say these conditions impact quality of life. So if you are talking about it, all that Dr. Petey said, Dr. Narendra sir said, all that actually we are talking about one thing is that it's going to impact the quality of life. So we realized that I think there is something that our women are suffering and then compromising on the quality of life. And then look at it, and if you're talking about an SUI, which the name itself per se says stress, urinary incontinence, and are any of those conditions which we have been talking about. So the women is compromising on the quality of life. So therefore, I think if you look at this state of the art machine, which we have introduced as FemiLift, which the experts would talk. It's not me. This is an extremely simple, safe, easy, very short, minimally invasive procedure. As sir said, it's a coffee break procedure. But the important point for us when we wanted to come up with this was one, given the fact that actually the compliance of the patient is a little lesser here, and explain them to come for the multiple sittings, it is difficult. So you heard them saying that it's just actually 2 sitting, and then you come back only for the memory sitting after a year. So that's very important. So it's extremely easy a procedure. That's number one. And second, the most important thing is almost painless, and then extremely quick. So for us, what we from the system point of view, it was about offering something very easy, and then if you really ask me, okay, one part is of the system, what else is happening? Because I think what we started off by saying it's a journey. So therefore what we have made sure is that actually, like we have started with this Break the Silence campaign, you will now start seeing physical campaigns very soon once the corona is done with. because I think it's important that we engage, we talk, with the actual patients, with the actual people in around, engaging the right experts, through various sources. So which is what actually we are going to do, very soon. In fact, as part of this break the silence campaign, now after this web series is done, we are going to go through bloggers, we are going to have face-to-face campaigns, we are going to have digital campaigns. We are looking at expanding this for next about 3-4 months. So it's a huge effort. And I think here certainly the fraternity, we have Dr. Narendra and then Dr. Petey here, industry, currently it's me, and then I guess and even the government participation also is extremely important, because look at the people. I think I have said this earlier, and I don't mind saying the people that are getting impacted. By 2025, as per the North American Menopausal Society, we will have 1.1 billion population under this menopause. So given that we are 1.3 billion in India, and then about 45-50% of women, the population, postmenopausal population, very high. So it's important that actually various bodies act on this, and then offer them the quality of life.
Sure. Going ahead, this will become an issue that will affect large number of women in our country. Dr. Preeti, because of COVID, because of the pandemic, and the lockdown is gone, but the entire fear hasn't. So what has been the impact of COVID-19 on cosmetic and beauty industry, and how safe is this procedure? Because really, it doesn't sound like it involves many things, and sterilizing and sanitizing many things, or close interaction with a lot of people or technicians. So, what has been the impact of the pandemic on the cosmetic and beauty industry?
Right. There are two parts in the question. First is that the impact of the COVID on the cosmetic procedure. As we understood from the previous conversation today, that it is not only about the cosmesis beauty, it's also about the functionality and rejuvenation. And the deliveries are taking place, menopause is happening, urinary incontinence is taking place. So if you talk about my experience during the COVID, yes, for the month of March and April, when it was a complete lockdown and everybody was very scared, yes, that time even we were scared, so we were not doing these procedures. But after that, now, as they are not done only for the beauty, so again for the different problems a person is facing. So we saw lots of patients coming for these procedures, because now this covers the second part of the question, because it is very safe. If any surgery is to be done, the patient has to go to the hospital, as rightly said by you. There's so much of paraphernalia, and then you have to get through so many tests, and then you are not sure, you're interacting with so many people, and you do not know from where you would catch the COVID. Now, the beauty of this laser procedure is that it is one-to-one procedure. Patient has to walk into the clinic. It just takes 3 minutes, and then patient walks out. And as far as the sterilization is concerned, the sterilization, yes, because we use separate cover and the probe, separate instrument for every patient. There is these are disposables, so we do not reuse them. So they are very safe. Then all disposable sheets are used. So in fact, in today's time, when we are not very sure about how the COVID precautions will be there in other settings, these coffee break procedures or the laser procedures are very safe for urinary incontinence, vaginal rejuvenation, recurrent vaginal infections, vaginal tightening, and for vulval whitening. Yeah.
All right. Dr. Malhotra, does one have to undergo a COVID test to go for this procedure? Why I'm asking is because my friend's child, the dog bit her, and so, she had to get a small little plastic surgery done on her face because the dog had bit her on the face. But for that, the kid had to undergo a COVID test, and that was a positive. And, there was a pandemic, pandemonium in the house, because, nobody expected the child to test positive. But that had to be done because the small little plastic surgery had to be done. What has been your experience? Do we need a COVID test to get this done?
So COVID has changed our normal outlook to the whole situation. It's taught us a lot of new things, and because of our carelessness of not wearing mask and social distancing, so we have not been able to control it. So how do we control COVID? Because we don't still know who has got it and who has not got it, because it's asymptomatic in most of the people. And if a COVID patient comes to the hospital and sits in front of you or undergoes a surgery in an operation theater, the anesthetist is looking down his nose and putting a tube in, and the nurses are all looking down to him, and he's in close contact with so many. And if he has COVID and not active COVID virus, he's on talking and it's coming out, everyone will get it. And they will put it to 10 other people, and those 10 will give to hundreds and thousands. So that made it mandatory for the hospitals to have a COVID test for any minor procedure or major procedure which the patients were coming in. It's not 100%. See, you're doing it to the patient, but you're not doing it to the family. So it actually, when I argued about it, against it, I said, see, if a patient is delivering, I've done it to the patient, but our husband, mother-in-law, they're all sitting in the room. They could also be positive, and they could bring COVID to the hospital. So if you have to do it to everyone who walks into the hospital, and do it free. In Agra, COVID test is free. We are not allowed to get private testing done at all. The government has taken the responsibility of doing it free on whoever we ask for. Only problem is the report comes after 3 days. So if I have to do a surgery today, I can't, an emergency can't be. The rapid test we can do ourselves, but then that does not give. So, but for this procedure, if it's a 10-minute procedure, for getting a COVID infection, you have to have face-to-face interaction with the patient for at least 30 minutes, and it's 10 minutes, so she's not interacting, and we are interacting with an area which does not expel COVID viruses. In one study, it has shown that vaginal secretions, some 1 or 2 cases have shown the COVID virus, but that's not infective. It has been seen in semen also. It's been seen in stool that way. It's also, but it's not like the talking in the droplet where it mainly comes from. So if you take proper precaution of masking yourself and covering with a COVID plastic shield, I don't think these people need COVID testing. But for cuts and procedures where admission is required, still a lot of hospitals on admission do a COVID test, yes.
All right. So we have started getting a lot of questions from the audience, and I'll start taking a few of them, and I'll request you to answer them, concisely and briefly, so because we have a few more questions to go over.
Sure.
So the first question coming in from a Facebook user is, Dr. Petey, I request you to answer this. I'm having mild troubles with urinary leakage. Is this normal?
Right. So any urinary leakage is not normal. There should not be a urinary leakage. Now, the most common cause for urinary leakage is urinary tract infection. So if you are very sure that you do not have a urinary tract infection, and when has your leakage started? Is it after I do not know the age of the person. So is it perimenopausal or is it after the deliveries? Thirdly, what type of urinary leakage? Whether it is on coughing, which is known as stress urinary incontinence, or is it dribbling of urine when after every 10 minutes you have to pass urine, or is it that way you go to the washroom and even before, and suddenly when you see the pot, you just leak? That is because of detrusor instability. Or so if we go concisely, that first of all, it is not normal to have urinary leakage. Second, there are different kinds of urinary leakage. They totally depend on your age and your cause and several factors. And according to the factors, it can be corrected.
So, Dr. Jindal, you would recommend that she gets it investigated, right?
Absolutely, yes.
Yes.
Right. Dr. Malhotra, another question coming in from a Facebook user. What's considered normal when it comes to vaginal discharge? Could you answer this, Dr. Malhotra?
So a little bit of sticky vaginal discharge occurs just after the periods, just before the periods, and mid-cycle, when your estrogen levels are the highest. And this is, if you put the finger in it's just makes a thread. So that is normal. That is normal at mid-cycle because it takes the sperms to go up for conception. Just before the period, this discharge becomes a little thickish and packish, so it obstructs the sperms from going up. That was how it was made. And just after the periods, a little bit of discharge from the uterus or from the cervix will still come. So it's estrogen dependent. So that is normal. It's like sweating. Now you will say, what amount of sweat in your axilla is normal? So some people don't stain clothes. Some people will stain clothes a lot, and it shows a lot. So it depends on people to people also, and it depends on their estrogen level, their obesity levels, and their age. If it is causing irritation, burning, itching, and it is curdy white and it is foul smelling, then it is bad.
All right. Another question, Dr. Preeti, I'd request you to answer this. From a Facebook user is, how does vaginal tightening work? I mean, you've spoken about it at length. And the question is, are the creams available in the market for vaginal tightening of any use?
Right. So vaginal tightening, how, as I said in different parts of different questions, the basic thing is to rejuvenate the collagen and elastin. Now, collagen and elastin can be rejuvenated by several methods. So, the one of the most effective method is laser, which works on the principle of giving warmth to the area, which stimulates the elastin collagen cell. And any energy-based devices like laser and other things which I mentioned, they all work on the same principle. So they are one of the most effective methods. And we have a series of more than 300 patients now, and in fact more, I have lost the count of it now, who have been benefited by this laser technique. Coming to the creams and estrogen, now in this I would like to correct one thing which was mentioned earlier about the estrogen creams. Estrogen creams are very safe if they are used properly.
Okay.
Of course,
Okay.
in the breast cancer. So breast cancer patients, as you mentioned earlier, we're not talking about the breast cancer patient. I'm talking about the normal population and postmenopausal population where estrogen creams may be used. Now, all these estrogen creams and all, they are not for tightening. They are just for the estrogenism, that is for the dryness, but not for tightening. So as far as scientific literature and experience goes, all these things do not function for tightening. The laser and energy-based devices are only your take for tightening and rejuvenation.
All right. So here are our experts answering all the questions that are coming from you. If you have more questions, type them in. They're still with us and we'll answer all your queries. Mr. Madhusudan, I wanted to ask you, do you think Indian women after crossing a certain age are aware of various feminine beauty treatments available in India?
I'll give you a small incident that happened during this web series, and we have been doing this for the last couple of months now. So one of the program which I was supposed to attend, I had put up the invite on my WhatsApp status, and then my friend saw this, and then he said, Madhu, please give me the link. I want to attend this. I said, good. Now who wants to attend? No, my in-laws wants to attend. So then I just said, are there doctors? No, they have some issue. I didn't want to check much on that. I said, okay, so you go ahead, and then I shared the link. And later, and I asked them to go through the program. They said, no, it's halfway through. They could not because battery discharge, something happened. Then I asked him, okay, great. So what do you want to do now? Can you give me the link again? I said, why link? I can actually advise you to go to some doctors. I can give you names, options. You decide whom you want to go to, and then take a consultant instead of actually going through the video, because video may have some Q&A, but then you have an actual consultation which actually is better. Now this gentleman says, no, I think please give me the video, and he is an engineer by profession. I'm sure the family also is well educated. The point I'm driving here is, we still do not want to consult. We still do not want to talk about it. We still want to hesitate. And therefore, I think the challenge, of awareness, Anisha, is not just about, putting it on something on the website or sharing them in the brochure. It's about actually encouraging people to talk. There is this condition that is treatable, and there is a simple solutions that are available. Not necessary FemLift for everything, but there are many other solutions that are available, including FemLift. So therefore, I think the first thing is that it's important to encourage them, and then awareness. When you talked about the awareness, and I personally think this incident once again just enforced my my thinking that it's a long way to go in terms of how much our people are aware about. because the situation, if you really ask me, because you said whether Indian women, now I'll give a little bit of global perspective. This feminine health is a big, I mean, it's a not big, and it's an important topic that gets discussed after a certain age at the clinics. So therefore, people after they cross in a certain age, they are recommended in upfront, and then they come up for the consultations, and they are aware of the options that are available, and they're also aware of the conditions they go through, and the choice is theirs, and then the doctor decides what needs to be done. So for us, it's still long way to go.
So all these talks with your doctor also will take time, I'm sure. But Dr. Malhotra, when should a patient begin treatment?
So it depends on what she is coming for. If she is on a vaginal health rejuvenation package, then we tell her, we start counseling her in pregnancy. So if you have a normal delivery, you could, after 6 weeks of delivering normally, you could take the vaginal rejuvenation treatment. So your vaginal health and perineum comes back to normal as fast as possible, and you can resume your normal sexual intercourse as soon as possible. So 6 weeks after delivery. But otherwise, whenever they come with any of the problems, if it is not infection, if it is not attributable to a pathological disease, the treatment should be started immediately.
Right. Dr. Petey, does any woman actually need the vaginal lift?
Vaginal lift. Now, it is not a vaginal lift if you are
like
referring to the prolapse. Okay, the tightening. Okay, so vaginal tightening, yes. I mean, I feel that those who can afford and those who have accessibility, one should definitely go for it. If possible, as early as possible after as put by Dr. NM sir, after delivery at our center, we are offering it to all the women after delivery. 6 weeks after delivery. All postmenopausal women, I always offer them, because they invariably have dryness, they have hypoestrogenism, they have also something very important, they also have loose vagina, and it also leads to pelvic floor coming down. Yes. So if you do vaginal rejuvenation by laser, it not only tightens it up, it also tightens your pelvic floor muscles, and it lifts the vaginal vault up, if that is what the person meant with uplifting. So, and these are totally harmless procedures, and the skin aging cannot be avoided, but it can be reversed. So all these problems, they happen with aging, and if we have something to rejuvenate and to halt aging, then why not? What's the harm?
Yes,
let me add something here.
Yes.
The maximum women who are availing this treatment are in the United Arab Emirates. So UAE, because of the scare that their husband is going to leave them alone, leave them because he finds a little bit of sex not enjoyable with the vaginal, because they're having 4, 5, 6 children. And I was there for an observer training with a couple of my friends. The maximum number of family clinics are there. And I was shocked to see how many women they just come and demand, just do my laser, otherwise my husband will remarry. So it's all boils down to that family problem again. So if your feminine health is not good, feminine health means not just physically free of disease. It is physical, disease, sexual, mental health, all three. And if your sexual health is not proper, your mental health will get disturbed, your family health get disturbed, and the whole thing breaks up. So it leads to a lot of broken families also. So that's where almost all women after a certain age in UAE go for a laser vaginal lift or laser vaginal tightening. Indians are different. So we are still not all that sexually oriented in the whole class. And it is totally male dominated still. So, but it's coming.
Yeah, so we're scratching the surface. We've got more questions coming in from the audience. Dr. Malhotra, I've requested to answer this question. The Facebook user is asking, can incontinence cause a loose vagina?
So incontinence does not cause, loose vagina causes incontinence. It's the other way around. If your vagina is loose, your urinary bladder is above the vagina. See, this is the vagina, supposing the urinary bladder is up there. So if this is loose and coming down, then the whole urinary tract is coming down. the urinary pathway, and that can change the angle of micturition, and that can cause leak. So it's the other way around.
Okay. Dr. Preeti, I'd request you to answer the next question. A Facebook user is asking, are there any everyday habits that might affect one's vaginal health?
Yes. You see, like any orifice of our body, nature has given us very protective mechanisms in the orifices. But nowadays we see a lot of advertisement about the artificial chemicals which people use in their vaginal areas to douche it or clean it. So one thing I would really like to request, you do not have to douche your vagina. You do not have to clean it with any artificial chemical. Once you're taking bath, just clean your outside area with whatever soap you use and water and dry it. Then every time you pass urine, do dry yourself with the toilet roll, because your female urethra is just 4 centimeters and it is relatively straight. So once you pass urine, some urine stays in the urethra. So after passing urine, count till 10, give one more push, and you will see few drops come. So if you do not do this thing, then it dribbles down onto your undergarments and it gives the bad smell, makes you damp and prones you to the infection. Thirdly, do not, after having intercourse, do pass urine before sleeping. Otherwise, it can lead to increased urinary infections. So these are few hygiene things which you can use. Avoid using talcum in the vaginal part and in the intimate part, because talcum anyway has been associated with ovarian carcinoma. Avoid using synthetic undergarments, wear cotton things, and if you have increased secretions or sweating, do change your garments at a frequent interval so you are not damp and are not prone to infections.
And good quality pads during your periods. No, that again is our major awareness campaign which we are running. Dot the red, green the red, and talk periods. So that's another campaign which we are running with our NGOs. So that also can lead to a lot of vaginal infections, cancers, infertility, and all these urinary infections and urinary leakage.
So, Dr. Malhotra, what is a good quality pad?
So the good quality pad is which absorbs properly and does not remain outside. And you can test it by using the pad and putting a cup of water over it. And if it soaks without feeling wet over it, that's it. And it should be wide-winged, so the blood does not leak from the sides. Or a good quality tampon also, if women are comfortable with tampons, that is also very good. And now we have menstrual cups. So menstrual cups, again, if married women are there, even for unmarried women also, but supposing it will break your hymen, so that virginity tag goes off. But it's a plastic cup which goes into the vagina and collects all the blood there. And with a thread, you pull it out at the day's end. So all the blood is collected there and nothing leaks out, nothing soaks it, and no infection. So these are the 3 things which we can follow. And cleaning outside, no douching inside. I've heard women pouring a full bottle of Savlon or Betadine inside the vagina. Now that's crazy. That will destroy the normal bacteria which the vagina has, which is your healthy bacteria, and then will cause a lot of infection.
All right. Dr. Malhotra, one last question coming from the audience is, can you get rid of vaginal dryness after menopause? Is there any treatment available for dry vagina?
So dry vagina is because your vaginal wall has undergone atrophy and it is not getting blood supply now. So the cells are not secreting. So cells are not secreting the normal secretions which should be there. It's like sweat or whatever you want to call it. Now this has happened because the estrogen levels have gone down. So the atrophy of the bladder and the vagina. Now, usually the initial thing which we start is by giving lubricant creams and some gels and estrogen cream. So that estrogen cream works on the local cells outside. It's not absorbed and causes those cells to restart working. And of course, the best treatment is vaginal laser. And vaginal laser you fire all around, make this cells, wake up these cells, wake up the collagen behind it. And if she has a very bad vagina, then after doing a laser, we put in PRP. PRP is platelet-rich plasma, which is taken from the patient's blood, and we separate the good cells out of it. The red blood is removed, the white blood which is there, and then after that we smear the vagina with it. So the holes of the laser which we made, it goes inside and helps in healing faster, the healing factors. And then, of course, you have to have good diet, good exercise, and multi nutrients. Vitamin D. Vitamin D is very essential for dry vagina, causing dry vagina and vaginitis. So vitamin D supplementation to all women, of course. So that is how we can handle that.
Right. Dr. Petey, would you like to add anything to this answer?
So vaginal dryness, yes, very nicely put up by NM sir. And another thing which I would just like to add, that the earlier you start treating it, the better it is. So the laser, the moment you get your dryness or you're at the perimenopausal phase, like 45 to 55, you don't have to be 60, 70, because the repair, as early it starts, the better it would be. And it would have better effects. So laser is definitely one of the best methods. Plus the remaining, that the estrogen cream and all should be taken properly, and rest everything as highlighted by sir.
Right. Mr. Madhusudan, how is ANMA creating a niche in various feminine concern areas?
We have actually employed very basic steps. I think the first and the foremost step we have taken, and which I've actually talked about, and is about educating the patients. And then we are going to we are going to come up with a major initiatives in the days to come. Through multiple initiatives, we are going to educate the patients, interact with them, engage them. So that's number one. Second thing is, I think this beautiful state-of-the-art family information, we are trying to make it available, which already is available across India, from Kerala to Delhi, Kashmir, it's available. We just want to make it available as many places as possible. Therefore, we not only just educate people, we make these machine available for their benefit. That's number two. We're also going to engage with the organizations, which Dr. NM sir said. We're going to engage them, and then conduct various training programs. So therefore, we are also not talking just about the education of the patient, but also training of the doctors as well. So these are the three major things we are planning and then employing.
All right. Dr. Petey, Dr. Malhotra said that anytime, especially you also said that you counsel pregnant women to start this treatment as soon as possible. Now, during childbirth, the interface is quite high with a prospective patient. How many of them actually take up your offer?
Almost 80% of my mothers, they take some one or the other form of help for the rejuvenation. So laser, yes, I do agree. People are still little scared of laser. But then if you counsel them properly, you tell them the benefits, then they do understand. And the women nowadays are very, very receptive to this idea. And they see the mothers and the grandmothers suffering from the problem. So they know that they have to start early. And almost 80% of my women, they take one sitting of laser, because after delivery, I offer one sitting. If they do not have any problem themselves for rejuvenation, probably one sitting is good after 6 weeks. But if they have dryness or infections, or they are having SUI, urinary incontinence or leakage, then 3 sittings, 1 month apart is recommended.
How do doctors, increase awareness, say for, the younger pregnant women group? The interface is always high. There will be vaccinations and many things. So you will, the interface with the patient is high. For perimenopausal, menopausal women, how do you increase the awareness? How do you advertise about the services that are already available to help them?
Counseling is the key to this answer. Repeated counseling, recurrent counseling, explaining them, showing them the videos, and see, everyone is intelligent. And if you tell them the benefits and they understand that it is actually going to benefit them, they do understand and they do come forth to take the treatment.
Right, but Dr. Malhotra, counseling will only happen once you interact with them. Why will a menopausal woman come to you?
So local language newspapers, local language magazines, articles, and then radio shows, radio talk shows, local television, local channels, talk shows. and advertise yourself as a dedicated menopause clinic. Every Thursday, 4 to 6, I see only menopause women.
Okay.
That's it. So a menopause clinic. So now this makes it very interesting. So you need to have an adolescent clinic. You need to have a pre-pregnancy clinic for pre-pregnancy counseling, because that also is needed a lot now. You obviously have an antenatal clinic for pregnant, and you have a post-delivery clinic because the psychological issues are there of mother and child, and then you will have a perimenopausal menopausal clinic. So for women, we need 5 different pronged attack on to cover the whole life.
So the doctors have already figured it out. It's a lot of work, but they're doing it. Thank you so much, Dr. Malhotra, Dr. Petey, Mr. Madhusudan, for joining us today. So this is our effort to increase awareness. If you're typing in your questions into the chat box, don't hesitate to reach out to your doctor to discuss this. If you have an issue, I'm sure there could be easy solutions available to treat them. I want to thank you all for taking the time to join us today. Thank you so much. Don't forget to follow us and stay updated on all the concerns about your health and well-being. This program was supported by Alma Femilift. Do follow us on Facebook and get all the updates on our upcoming programs. Keep sending us your questions. We will take them up in our subsequent shows. Till then, stay at home, stay safe, take care. Goodbye and see you soon.
Remain beautiful.
Thank you. Thank you.